Good evening and welcome to tonight's COVID-19 Vaccine Town Hall. My name is Adam Veal and I'm a Deputy Communications Director for Congresswoman McBath in her Sandy Springs District Office. We've convened this evening's conversation to talk about the ongoing progress that is being made to distribute and administer the COVID-19 vaccines. We're joined by three local experts who have been on the front lines of vaccine development and distribution. At any time during the event that you wish to ask a question, please press *3. If you would like to subscribe to the Congresswoman's official newsletter, please press *6. And now it is my pleasure to introduce Congresswoman Lucy McBath.
Well, thank you so much, Adam, and good evening, everyone, and thank you so much for joining us tonight. I'm always so excited for the opportunities to be able to connect with you at a time when it's really important that we continue to, observe the guidance of our public health experts by staying away from large in-person gatherings. So this we find is the best way to stay connected to you and making sure that we are still serving your interests and your needs. And I miss being able to gather with you all in person, but I know that by limiting our exposure and following the expert guidance of our public health leaders and wearing our masks, that we're doing our duty to protect the health and the safety of not only ourselves, but our families and our neighbors. These simple but, just very effective practices really will help to save lives. And I want to commend all of you who've made really great sacrifices to protect our public health. Each of you is doing a phenomenal job, and so your actions truly are making a difference in the fight against COVID-19. It's sometimes difficult to believe that, the COVID-19 pandemic has been ongoing now in the United States for over 12 months. And I want to offer my profound gratitude to our frontline medical personnel and staff, all the support staff who continue to put their lives on the line for us every single day since the pandemic began. Now, we're enormously grateful for the service and the sacrifices that you and your families, have made to save lives. So you continue to do that every single day. And finally, I want to give my condolences, as always, to those who have experienced the most painful elements of this pandemic. And whether you lost your job, or you're struggling to keep your business afloat, or you're grieving the loss of a family member or friend, please know that you are truly in my thoughts and prayers. I pray over our district. I pray over the state of Georgia. I pray over our nation every single day. And I always want you to know that my top concern is ensuring that you and your family have the resources, the support, and all the federal assistance that you need to be able to continue to move through this chapter of our history. In Washington, I have worked hard to remain committed to doing everything that I can to provide so much sorely needed assistance to the residents of our district of the 6th. In the first 6 weeks of the 117th Congress, we've already seen a great deal of activity, and I'm really pleased that we're moving forward with consideration of the American Rescue Plan, which I will actually go back to Washington to vote upon next week. The Education and Labor Committee, which I actually sit on, has already, we've held a very lengthy markup on the education and labor portions of this plan. One of my staff members actually she sat with me. We started at 3 in the afternoon for labor and education and labor on that committee, making sure that we were moving through the budgetary process to provide all of the resources, financial resources that you will need. And we didn't finish until 4:30 the next morning. So I assure you, we've been working really, really hard to make sure that we're proposing bold relief on behalf of the very real needs that you, the American people, still have in the midst of this public health crisis. And first and foremost, that means, getting another round of stimulus checks into your hands. You need financial support, additional financial support now more than ever. So with respect to education, that also means safely getting our children back to school and working with the local administrators and teachers to make sure that we have the safety measures that we need to put in place to get our kids back to school as safely and as quickly as possible. And then finally, the American Rescue Plan, which I just touched upon very briefly, is going to really help continue building on the progress that we've already been making with vaccines and all the work that we've done previously. The American Rescue Plan, which is what we're calling it, will actually make sure that we're ensuring that COVID-19 vaccines are free for all those who wish to get it. It's not mandatory. You do not have to get the vaccinations, but we are making sure that everyone who wants the vaccine can get it as a critical part of moving beyond this pandemic and beginning the road to recovery. And I know that our lives have been so sorely disrupted by the pandemic for over a year now, but I do believe that we have reason to be hopeful now more than we ever have. And in the last few months, we've watched the rapid progress that was made to develop and actually approve COVID-19 vaccines. Results from many, many clinical trials have shown that these vaccines are very highly effective in combating COVID-19, and they're just bringing us one step closer to defeating this pandemic. And there are so many encouraging statistics out there that, I'm sure we've all had a chance to read them every single day about our progress on vaccination. What we do know is that 1 in 20 Americans are fully vaccinated right now. And every state in the country has given a first dose to at least 1 in 10 people. And that at least 1 in 8 Americans have had at least their first shot. So that is very, very encouraging. And there is even, further reason just to be encouraged as our national vaccination progress continues to trend upwards. We're seeing those trends move forward, and we're increasing our vaccine capacity each and every day and getting more shots in people's arms. Tonight, we are joined by 3 local experts who have been on the front lines fighting this disease, and they will actually speak to the ongoing vaccine development progress right here in our own community in Georgia's 6th Congressional District. And I'm so thrilled to welcome back these experts, as each of them has played such a great role, a huge role in at least one previous event with our office throughout the last year. And your partnership is so valuable to me, and I'm excited to spend another evening speaking with all of you and just kind of learning about what updates you can share with us on the work that you are all doing on behalf of our district. Tonight, we are joined by Dr. Sandra Ford, Rob Schreiner, and Colleen Kelly, who are here to talk about the work and the ongoing development and distribution of the COVID-19 vaccines. And Dr. Sandra Ford has served as the District Health Director and Chief Executive Officer of the DeKalb County Board of Health since February 2005. Dr. Rob Schreiner is President of the WellStar Medical Group and Executive Vice President of the WellStar Health System. Dr. Colleen Kelly is an Associate Professor of Medicine in the Division of Infectious Diseases at the Emory University School of Medicine. Dr. Kelly is also a site investigator for the HIV Vaccine Trials Network at the Hope Clinic of the Emory Vaccine Center. We're particularly grateful to hear more about her work tonight as the principal investigator for the Moderna study at the Ponce de Leon Center at Grady. We're very, very blessed to have so many talented public health experts right here in our own backyard, and I'm incredibly excited to welcome all 3 of our guests tonight. And any time during this evening's conversation, those of you that have joined us tonight, if you have a question, please press *3. And if you would like to subscribe to my Congressional newsletter, just press *6. And now I believe we have several folks tonight that are waiting, such as myself. We're all waiting to be able to just hear from our experts. And I will just let Adam take it away.
Well, thank you, Congresswoman. Our first question is from David, and David has a question about vaccinations for children. David, you are live, and you can go ahead and ask your question for Dr. Kelly.
Yeah, I was actually wondering if there was going to be a faster track for like the Johnson & Johnson or the AstraZeneca vaccines for children. I know that they're more of your traditional vaccines, so I was wondering if there's a chance that those would go by a little faster.
Hi there. Thanks so much for your question. This is Dr. Colleen Kelly, and thanks to Congress Congresswoman McBath and her office for inviting me to come. I'm not sure it will be a faster track in that I don't think that any steps will be skipped for approval of those vaccines. All of these vaccines have been fast-tracked like nothing we've ever seen before, and so I anticipate that the trials, the clinical trials that do still need to happen for younger age people still need to be conducted, but I do think they will be conducted as quickly as they possibly can. So just to remind everyone, the Pfizer vaccine has been approved for folks down to age of 16, and we are awaiting data from the company for vaccines down to age 12. In addition, the Moderna vaccine is approved down to age 18, and they also are enrolling a clinical trial cohort down to age 12. And then from there, we anticipate younger and younger age groups being added to the trials. With respect to Janssen, I know that they are planning younger age trials. I am not clear on AstraZeneca at this point in time. I think we need to see some data from the U.S. trial in adults where that stands. In other countries, though, they certainly are moving on to younger ages, but just in reference to the U.S., that's where I understand things stand with that company. So I'll stop there and hopefully answered your question.
Great. Thank you so much, Dr. Kelly. I believe our next question is coming from Patrick. Patrick has a question about vaccinations for teachers. Patrick, you are live.
Hey, thank you. I thank you, Congressman McBath, for giving us all this information locally. I appreciate it. I'm a school teacher in Gwinnett County, but I live in Brookhaven, Georgia, and I'm curious as to what timeline for teachers are going to be able to start getting the vaccine so that we can be safe for our children.
Hi, this is Dr. Ford. I think I can try to answer that question for you as best I can.
Thank you.
Sure. Right now, we are still in Category 1A+, which is first responders, healthcare professionals, and senior citizens over 65 and their caretakers. Actually, the governor today on a press conference said that there would be discussions in the next 2 weeks about expanding the current priority groups. As I hope you all are aware, this week has been a nightmare in terms of the weather has completely prevented any vaccine from entering the state. So now we're even farther behind, but it's my understanding that there will be discussions in the next few weeks about the next priority groups to move forward. And certainly the teachers have been in discussion for quite some time, as we understand that everyone is eager to have school back in session.
And thank you for that question. And absolutely, it's imperative that we really listen to and work with our local school administrators who are the most familiar about, what works best for each school and every district. Their needs might be different. So I'm still very committed, at the federal level to fight to make sure that we have access to the resources that our schools need to get our kids back to school as quickly but most definitely as safely as possible. And that's the reason why I'm supporting the American Rescue Plan, which really kind of provides those resources, and it provides testing and also vaccination plans that our schools can safely, so that our schools can kind of, safely reopen as quickly as possible. And we've got to continue to make sure that we do everything that we can to ensure that our children are learning in an environment that's healthy and best for their education and keeping them safe. So we want to make sure that we're doing things above all in order and making sure that we're providing the best that we can for our children. Thank you for the question.
Great. And I believe our next question is from Ken. Ken has a question about the rollout of the vaccine. Ken, I'm going to take you live so you can ask your question.
Thank you so much. Congresswoman Macbeth, thank you so much for holding this. As you can imagine, we're getting confusing messages out here, and it's hard to know exactly what's going on. I guess what I want to know is, I'm going to change my question a little bit. About a month ago, I got an email from Emory saying, "Hey, it's time to sign up and everything," and I did, and I've been waiting and waiting and waiting. Then the other day I got a message from Northside and said, "If you'd like to sign up for the vaccine, please do," and we did, my wife and I, and we got our vaccine yesterday. And I'm still waiting to hear back from Emory. Why this confusion? And that's my question.
Did either one of our experts want to answer this?
Hi, Congresswoman. This is Dr. Schreiner. Adam, if it's okay, I'll try this on. So first, each of us, Dr. Ford, Dr. Kelly, and I, each of us have empathy for the frustration that you and many Georgians are experiencing in wanting the vaccine and then a delay in receiving the vaccine. So number one, we get it and we hear you. Number two, each of the health systems, Emory, Northside, Wellstar, Piedmont, all of us are doing the very best that we can with the limited vaccine doses that we have. And so all of us, Emory in this case and Wellstar, have sent emails to patients who have been through our system in the past who meet the 1A plus criteria that Dr. Ford mentioned before. And we, Wellstar, sent out 120-something thousand of those emails, and about 100,000 said, yes, I want it. And we've had supply so far for only 36,000. So, those of us who are part of the larger health systems, Dr. Kelly and myself, are enthusiastic about the American Rescue Plan that Congresswoman mentioned earlier, because it does hold the promise of producing more vaccine doses in a shorter period of time so that we can be more responsive to patients like you and get you scheduled immediately once you opt in and meet the criteria for vaccination. But the last thing that I'll say is all of us buy into the science behind prioritizing certain patients over others, certain people over others in this setting of vaccine scarcity. So while it's true, Dr. Ford sets the criteria, and the State Department of Public Health sets the criteria for who gets doses first, all of us, Dr. Kelly, myself, my colleagues at Piedmont and Northside, all of us believe in and support the epidemiologic science behind that prioritization. So I doubt that makes you feel any better. All of us are happy you did get your vaccine. I practiced at Northside for 20 years. It's a wonderful institution and hospital, so I'm so delighted you and your wife got it, and we are sorry that we don't have more vaccine doses.
Thank you, Dr. Schreiner. Really appreciate that. Our next question comes from Sitara from Marietta. Sitara has a question about, kind of in the same vein, about vaccine prioritization. Sitara, I'm going to take you live, and you will be able to answer or ask your question of our experts. You're now live, and you can go ahead with your question.
Thank you so much. My question was, again, about prioritization. Individuals with disabilities and developmental disabilities are not, they're not listed anywhere in the prioritization. And so I was wondering, is that something that they're going to change? We've been trying to advocate pretty hard with the governor's office, trying to get individuals with disabilities who are, above the age of 16 and under the age of 65 to come, to be listed somewhere in the high priority list.
Yes, hi, this is Dr. Ford again. I can answer that question as best I can. So the governor does make the decisions in terms of expansion of priority groups. And that question did come up actually on a call with the Commissioner Toomey, Tuesday. We have calls several days a week. And, it's really up to the governor at this point and vaccine supply, because the other issue is that population is a very, very large population. And so before we expand priority groups, we need to make sure that we have enough vaccine to support that.
All right. Thank you so much, Dr. Ford. We have a question from an online submission. This next question comes from online. It is, what is the recommendation for children to return to schools safely?
Well, I guess I'll answer that one too. This is Dr. Ford. Well, as best I can. The recommendations are really school district by school district. CDC has some guidelines, but they are based very individually on rates of infection in the different districts, and so there's a lot to it. And so the main recommendations have to do with mitigation strategies. Are we doing everything we can in the school setting to allow for adequate social distancing? Are we able to have enough manpower to enforce mask wearing at all times? And can we keep general contact areas safe to protect from infection? So it's a sanitization issue, it's a distancing issue, coordination in terms of physical activities and lunch. All those types of things have to be thought about. So it's a very heavy lift, and that's why we try to support the various school districts from the public health perspective. We are not in the business of providing directives in terms of opening schools. We can only provide the public health level information about rates of infection and provide some guidance on how to keep students and faculty and staff as safe as possible should a school district decide to open. Thanks.
Thank you so much. Our next question comes from Philip from Marietta. Philip has a question about vaccines for minority communities. Philip, you are live with your question. Go ahead.
Thank you for taking my question, and really appreciate it. My question is, I know there's been emphasis in the Fulton County area to reach the minority community due to the skepticism of the virus. But for those that wanted, I guess in the area of Cobb County and everything, what steps have been taken to try to reach out to the minority community to take this virus, not the virus, but the shot, the vaccination? And then second question is, me being retired and over 67, and I too got a message from my medical facility, WellStar at that, and I signed up and I never heard from them. And I know I can go to the vet, but I'm very skeptical of the VA, anything from them at this point. And so I don't know, now I kind of decided to take the shot, don't know how to get set up for it anymore because I can't get through. So I guess the real question is what is being done to reach the minority community in Cobb County? And second fold question that I had, when the teachers come up to get their shots, or whenever you guys schedule it, would that include substitute teachers and parapros like myself?
So, Adam, if it's okay with you, I'll start, and Dr. Ford and Dr. Kelly can pick up what I miss. So, first of all, thank you for your question. And again, each of us has sincere empathy for the frustration that you and other citizens feel in wanting to get the shot, as you said, meeting the criteria to get the shot, 67 years old in your case, and not yet being able to get it. So we are working on it, and right now we just have more people who want it than vaccine doses. Anyway, getting to the, how are all of the health systems solving the race equity issue? And it is real. So in general, everybody, but particularly disadvantaged communities, need three things to get the vaccine. Three things. Number one, they need time to navigate the appointing-making process, time to compete for the limited appointments, time to travel to the vaccination setting. So number one, people need time. And by and large, families that are working in hourly jobs have less time, less disposable time, less non-work time than others. So that can exacerbate racial inequity in receiving the vaccine. Number two, people need tech. Most of the appointments that are offered by our health systems, Emory and Wellstar included, are offered online, and not everyone in our community has smartphone access, broadband, and so forth. That's a harder one to overcome. Number three is trust. You mentioned this, in what can we, the healthcare industry, do to enhance the trust that the vaccine is effective and safe. And so what are the five things that Wellstar and Emory and other health systems are doing? Number one, we are prioritizing half of our vaccines by zip code. And those zip codes, particularly in Cobb County and areas of Fulton, that have underrepresented or folks with lesser means to get the vaccine. So we are prioritizing half of our doses for folks who need it the most. Number two, we're citing our vaccination locations near public transportation. Number three, we're enlisting local leaders as vaccine ambassadors, for example, pastors of congregations or co-workers. Number four, we are providing a phone option for scheduling the vaccine appointment, but it is so much less efficient and results in telephone tags so often. But there are phone options for folks who don't have access to tech. And then lastly, we are offering vaccine appointments in the off hours, where hourly workers have a better shot, no pun intended, of getting the vaccine. So, for example, Saturday, Sundays are 4 to 7 p.m. So we all of the health systems are doing what we can to solve race inequity in vaccine distribution and uptake, and we have more work to do. Dr. Ford or Dr. Kelly, do you want to add anything to what I've said?
Sure. It's Dr. Ford. First of all, sir, thank you for your service. Always appreciated. I am DeKalb's district health director, but I would imagine that we all of the public health districts have similar strategies to specifically encourage communities of color to receive vaccine. The first would be accessibility. I don't really believe that this vaccine hesitancy is as extensive as people say. Just like yourself, I think very excited about the fact that you're even interested in getting the vaccine. And so I think that it's more of an access issue than a fear issue. And so if the vaccine were more easily available, I think more people in general would be interested in taking it. That being said, we are partnering in DeKalb County with the faith-based community to make sure that our churches that have health ministries are able to support us in providing vaccines to not only their congregation but to the surrounding neighborhoods. And so that's one way that we are planning to make sure that we target our African American community specifically, but we're also working with our Latinx community, working with the local embassies, and the Latin American Association to make sure that we also target Spanish-speaking churches and provide a lot of outreach in those communities and answer any questions. I think transparency is the way to go. We need to be honest about the vaccine. It's a 2-dose vaccine. Sometimes people don't like anything that has more than 1 dose. It is painful. It hurts. But you need to say these things up front so that when you have a sore arm the next day, you don't think that there's something wrong. And so the second dose tends to have more symptoms than the first dose, but that's because it's more of an immune response. And so these are things that we just need to share with the community so that when your neighbor gets his second dose and feels terrible the next day, you don't think that that's something wrong, that they understand that that's just the immune response. So I think it's a matter of just communication and access. We have a call center now, and we'll, in the next few weeks at the state level, have a statewide call center, which I hope will make it easier for folks who don't have a computer or don't have the time or patience to sit online all day to just simply call this number and be scheduled for an appointment. So we are definitely doing everything we can at the state level to make sure every single person in this state who wants a vaccine not only has a vaccine but understands how important it is to get it. So I'm hoping that after you get your vaccine that you'll share it with your community and let them know how easy breezy it was. Thanks.
Hi, this is Dr. Kelly. I was just going to say I don't really have anything else to add. I think that those answers are very comprehensive. Only that I truly hope that we are learning so much about how to address inequities from COVID that moving forward that addressing inequities in health will expand far beyond COVID and COVID vaccination from what we learn now.
And this is Congresswoman, and thank you so much for that question. And I assure you that, my colleagues and I are actively working to make sure that the minority community is included in the vaccine rollout. In fact, in a lot of the wording and the language within the package that we're putting forth, we have made sure that we directed language specific to making sure that those resources were, identified for the minority community, because we have seen the disproportionate effect of the virus on minority communities, and it's really imperative that we continue to do that kind of outreach necessary to make sure that those communities have everything that they need to get vaccinated. And, also that means that we continue to reach out to our friends and our neighbors and tell them about these vaccinations and let them know that the vaccines have gone through rigorous testing. I've had people say to me over and over again, did they skip phases? Did they, did all the phase of testing and the research and the data that needed to be done, has it been, are they skipping phases and steps? And I had to reassure them, no, they are not. But, I know also, too, that my colleagues and I have been given the opportunity to do public address announcements. In fact, we have the opportunity. I will actually be doing one tomorrow, trying to make sure that we're encouraging people within our districts, within our communities to go ahead and get the vaccination, that it is safe to do so. And in accordance, with the guidance that we've received from the intending physician in the House of Representatives, I now have actually received both doses of COVID-19 vaccine. And once again, I just want to reiterate that the vaccines have been through really rigorous testing and they are safe. So if you're at all worried about receiving a vaccine, please consult with your doctor. But it's never been more important than ever that we just make sure that everyone in the nation is getting the vaccine if they so choose. We need to save as many lives as we possibly can. And I can attest to the fact that, yes, the second dose, I did have flu-like symptoms. It lasted all of 24 hours, and I was right back, out the door again. So they are safe. And I highly encourage everyone to please take this seriously and make sure that they are getting the vaccinations.
Thank you, Congresswoman. Our next question comes from Elaine from Marietta. Elaine has a question about the timing between vaccine doses. Elaine, you are live and you can go ahead and ask your question.
Okay, my question is, how long can you wait between doses? My husband had the Pfizer vaccine on January 15th at the dialysis clinic that he goes, and he's still waiting for his second dose because they're still waiting to get it in. And I just wanted to know what's the length of time between doses.
Dr. Kelly, would you mind taking that one?
Sure. Hi. Thanks so much for your question. I know that there is a lot of anxiety in getting that second dose and getting that second dose on time. The recommendation, the official recommendation, is to get it as close as you possibly can to the 3-week interval for the Pfizer vaccine or the 4-week interval for the Moderna vaccine. That said, longer intervals in vaccines have actually been shown to be a good thing as far as developing a more mature immune response. And so a delay of several weeks is likely going to be just fine. So I would just encourage your husband to get the second dose as soon as he can, but don't worry too much, and that a delay of a few weeks' time is going to be just fine. I believe that CDC has even officially now come out and said a 6-week interval delay should be okay, and people should not panic if they're not able to get that second dose. So hopefully he gets it very soon. But I think it will be okay to delay it a little bit more. You may have seen even in the news that some countries, the UK in particular, has recommended prolonged intervals of even 12 weeks in between the vaccines because they do believe that it will be okay, that an appropriate immune response will still be generated. So it is anxiety provoking. We do want folks to get the vaccine as close as they possibly can to that recommended interval. But if you are unable to, don't worry, just get it as soon as you can.
Thank you so much for that answer. Our next question comes from online. There's a lot of interest about vaccine distribution and the work that's going on in Washington. So this question is for you, Congresswoman McBath. What is Congress currently working on in order to help facilitate vaccine distribution?
Well, thank you for that question. Right now, the Biden administration is vaccinating about 1.7 million people a day. That is the goal. And they've been working, with all of our state governments to manage the distribution of the vaccines, across the country. At the federal level, I remain committed, as all my colleagues do, to providing all the federal, state, and local governments more resources, which we know they need to continue to facilitate and expedite the vaccine distribution. But we've got to continue to act quickly and work as quickly as we can to get the vaccination to every American. And that has always, right now, been, as I'm definitely hearing over and over again, there are numbers of people that are still waiting to get those doses. So we are working as diligently as we can. That's the reason why we're working to make sure that we're passing the American Rescue Plan. That is a COVID-19 relief package. That's really going to make sure that we are accelerating this national vaccination program to speed up the distribution of the vaccines and making sure that there is no lag time in between the times, that individuals are getting their second dosages or even getting the first dosage if you've, been told that, there are no vaccines available. So the program, with the American Rescue Plan, it expands testing and tracing for the virus. And also we're going to give more assistance to our small businesses and unemployment for those who've been laid off, and also funding for things like childcare and also school safety equipment, all those things that are needed. We need nutrition programs so that we can get life back to normal as quickly as possible. So we are going to be passing this package very soon. And there again, we'll continue to make sure that we are getting, the vaccine distributed as quickly as we possibly can, because we know the faster that we do that, the faster that we're able to reduce the number of cases of people that are contracting COVID, and the faster that we are able to do that, then we're saving more lives and getting people back to health and getting people back to a normal sense of living again. Thank you for the question.
Thank you, Congresswoman. We've got a question for Dr. Ford from Jonathan from Sandy Springs. Jonathan has a question about the administration of vaccines from dentists. Jonathan, you're live, and you can go ahead and ask your question.
Great. Thank you so much for having this discussion and allowing my voice to be heard. My name is Jonathan Orozco from Sandy Springs, and I'm a small business owner, so it's actually really good to hear that there's more assistance that's coming down the line. So thank you all so much for fighting hard for that right there. So I actually have two questions. The first question is, has there been any discussion about allowing dentists to distribute the vaccine? Because on average, they give probably more injections than any other doctors. That's my first question.
So yes, they are included in the governor's newest executive order as a population allowed to provide vaccines. So yes, we are very excited about that. From our perspective, all hands on deck, as many as possible. Next question.
That's a sub-question to that right there. When do they think they're going to be able to execute?
Well, when you say can they administer vaccine, are you meaning to your staff or to the general public?
Well, I guess to the general public, because, I mean, you know, right now, I know that they've got like CVS and other pharmacies and so forth that are starting to do that. But, you know, again, we're trying to tap into all the resources to be able to help and do this as quickly as possible. So I figure there's a lot of dentists. Sure.
So in DeKalb County, and you're literally right across the border because I live in Sandy Spring, we have a website where we are actively recruiting volunteer clinicians to assist us in vaccine provision when our supply becomes more adequate. So I can certainly recruit you in DeKalb, www.decabhealth.net, and we will get you credentialed, and we'd be happy to have vaccine. There's also a statewide volunteer site, servega.gov, I believe is the website. That is also a statewide volunteer recruitment opportunity for folks who are interested in supporting vaccine delivery. Thanks.
My question over here. So as you all had mentioned about like the UK, other countries such as the UK have a central app used by the NHS, their national healthcare system, to contact trace, to track, to announce, to inform, and to cue citizens to receive their vaccines. They were able to launch this within 2020. Who would I contact to help in the development of this app? Because that's actually what my company does, and I haven't heard or seen anybody. I keep on hearing about phone numbers that can be called, websites that can be just, but there's just really no central way. And I figure, you know, for fighting a pandemic like this, we really need a unified way of doing this. And it seems to me with the technology that we have in place right now, an app would be the best way, since that's something that we can use on our phones. It has contact tracing, you know, on both Androids, you know, iPhones and other platforms.
Sure, you're absolutely right. We actually do have a statewide app that will be launched next week, actually. I believe it's the 25th or the 26th. That is a statewide registration app for vaccine administration and to schedule appointments. I do not know whether it's tied into the testing process, but there is also a statewide app for that. So we are looking forward to launching that sometime next week. There have been a few of us selected as pilot sites, and we'll be starting a little earlier than the rest of the state so we can work out any of the potential glitches. But yeah, we are all very much looking forward to a statewide site, because right now each district is individually managing its own registration process. For small districts, that's not as big of a lift because they can literally do that on an Excel spreadsheet. But for someone with a population like DeKalb, Cobb, or Fulton, where there are literally millions, that's not a possibility. And so we're all going to be happy to see just a statewide registry where everybody can have a single site where they can register, be notified of their appointment, schedule their appointment, and be directed accordingly anywhere in the state.
And I'd like to say we'll be more than happy, my office will be more than happy to chat with you as well. My legislative director, Michael Williams, who also is my senior policy person for all things healthcare and veterans, is more than happy to kind of and open to connecting you with the CDC. So please give us a call, and we're more than happy to help expedite that for you.
Thank you so much for those great answers, y'all. Really appreciate that. We've got another online submission. This question is for you, Congresswoman McBath. Do you support more COVID aid?
Well, thank you for the question. Absolutely and unequivocally, yes. It's clear, it's been made clear to us that families across the country still continue to feel the effects of this pandemic. And, there's so much more that we still have to do to ensure that we're providing our workers and our families with all the resources and the tools that you need to survive this pandemic. And also working to make sure that the vaccine is distributed to every American that wants it. The majority of the Americans support this rescue plan that we've been working on because they know that if we don't act now, we know that if we don't act now, millions more are going to lose their jobs, and children are going to continue to lose additional semester of schooling. We know that some of them are falling through the cracks, that the virtual learning has not worked specifically for every child, and families across the country continue to struggle to feed their families. So it's imperative that we continue to work to provide the services that you need. The American Rescue Plan, we know, is going to create this national vaccination program that we hope is really going to help speed up the distribution of the vaccines. And we know that we still have to expand the testing and tracing for the virus. All of those efforts need to be expanded, and we know, too, that we're going to still need to provide additional assistance for our small businesses, struggling small businesses. I know actually that in the district, our mandate now is to really expand our ability to be able to really help our small business community because you are reeling. And it's nothing that you're going to come out from under overnight. And we know that also under the rescue plan, we're trying to extend unemployment benefits for those who've lost their jobs. And you've lost your jobs, many of you, through no fault of your own. And so we know that the rescue plan is also going to expand all of the federal nutrition programs. There's so much food insecurity out there for so many families, and we've got to be able to help address the current hunger crisis that we are reeling under. And the rescue plan also really helps to provide funding for child care. We've definitely noticed, that parents cannot effectively get back to work, cannot go back to work, and not unless, they have viable child care. And it also, the funding also helps us to defeat this disease and also keep our families healthy and whole, which is absolutely our goal. And that is what we continue to work on day and night. So thank you for that question.
Thank you, Congresswoman. We've got another online question for our experts. This is from Corinne. Corinne wants to know, how effective is the vaccine and how long does immunity last? I'll let our experts take it away. Dr. Kelly.
Yeah, Dr. Kelly.
Sure. Yeah, sure. Thank you. How effective the vaccines are in clinical trials, both of the Moderna and the Pfizer vaccines, were 95% effective, meaning that the rates of new symptomatic COVID disease were 95% lower in the group of people that got the vaccine compared to the placebo. We are still awaiting some real-world efficacy results. So first we get an estimate from a clinical trial, and then we roll out a product, whether that be a vaccine or a new medication. And sometimes the efficacy of those products, in this case a vaccine, in the real world can be different. And we just don't know until that happens. We do have some very preliminary data from Israel where they have vaccinated more than 25% of their population, where the efficacy in Israel, the real world efficacy, does look to be very, very high. It looks to be upwards of 90 to 95%. So that is really, really fantastic news for these first two vaccines, the Pfizer and the Moderna vaccine. So at this point in time, all we can say is what we know from the clinical trials, and that we're gathering more data on how effective these vaccines will be when they're given to millions and millions of people, which is what we hope, and eventually billions across the globe. Of course, there are other vaccine candidates that are coming down the pike. We are awaiting the FDA review of the Janssen vaccine or Johnson & Johnson vaccine. That's a single shot regimen, and they will be reviewing that. I believe it's on February 26th, if I have my dates in my mind correctly. And so we will see what they think about that vaccine. That vaccine does not appear to have as high of an efficacy rate as the Moderna and Pfizer vaccine to protect people from symptomatic disease, but it does look to be very, very good at preventing severe disease, hospitalizations, and death, almost complete protection from those very serious outcomes, also similar to the Pfizer and Moderna vaccines there. So it could become a little bit more tricky, and we'll wait to see what the FDA says about that Janssen vaccine, and we'll wait to see what CDC and ACIP, which give our vaccination guidelines for the United States, say when that vaccine hits the market. But time will tell. With respect to how long does the immunity last, it would appear that the immunity lasts at least 3 months at this point in time. I would say it lasts many months longer than that. We have to follow these clinical trial participants for months and continue to test. Very good. And I would anticipate that these vaccines will produce immunity that lasts at least many months, if not longer than that. So hopefully that answers your question, but I think we are still gathering information. We still have to wait and see what will become of these new vaccines that are coming to market, and time will tell, and we just have to be patient, even though we want, and I want very much to have all of the answers right now. Thank you.
Well, thank you so much for that really thoughtful answer, and thank you to everyone on the call tonight for your questions. If you didn't get the chance to ask your question tonight, or you think of something that you'd like to ask in the future, please don't hesitate to reach out to our district office by calling 470-773-6330. Again, that number is 470-773-6330. And now I'd like to hand it back over to Congresswoman McBath for some closing remarks.
Thank you, Adam. And thank you, everyone, for joining us this evening. And thank you for all of those of you that sent in these really incredibly insightful questions. And thank you once again to our experts for lending their voice to this very important dialogue. And we'll continue to dialogue with you along the way to make sure that you know exactly what is happening with vaccine distribution and what is happening with tracing and testing all along the way, so that you can be rest assured that you know things are moving effectively in the direction that they should, so that we're trying our best to make sure that you are healthy and safe. And to all those that joined us this evening, I hope you found our experts' presentations very informative and hopefully engaging. And it's always our goal to make sure that everybody's questions are answered. And I'm so sorry that we didn't get to answer every question tonight, but if you discover, that you still have a question that you want answered, or you have a question at a later time, please don't hesitate to reach out to my office. We're always happy to assist. As I've always said before, I have a dedicated team. I'm very, very grateful to have the team that works with me, who's always ready to help answer any questions that you have about the topics that we touched on today, or any other federal issue that you're concerned with. Additionally, if you require casework assistance with any federal agency, please don't hesitate to give us a call or to email my office. We are here to serve you. And the phone number for my Sandy Springs District office is 470-773-6330. And our casework email is casework.mcbath@mail.house.gov. Again, that phone number is 470-773-6330, and the email is casework.mcbath@mail.house.gov. Thank you once again for your engagement with my office, and it's always an honor and a privilege to represent you in Congress. In the weeks to come, I really pray that you all remain healthy and safe. Please continue to follow the guidelines. I know that we're getting vaccinated, but still make sure that you wear your mask, wash your hands, 6 feet apart. Please make sure that you follow those guidelines. And as always, please don't hesitate to contact my office at any time. Take care, and God bless.